Hello everybody, I am Joanne Haigh. We welcome our viewers and listeners in Barbados and around the world to another edition of Face It and Fix It on CBC TV 8, CBC Barbados Facebook and YouTube, and of course Q100.7 FM radio. Now, we continue the discussions and we have no choice based on the situation in Barbados and the world. COVID-19 has literally sucked the oxygen out of the atmosphere for most of us. But it's a real concern, and one that if we don't manage and find some solutions, we will continue to find ourselves going around in circles. This morning, to help us better understand what is happening around the Caribbean as it relates to COVID-19, we have invited back to the show Dr. Brian Charles. He is a specialist emergency physician. In addition, we have Dr. Corey Forde. We know that Dr. Corey Forde is an infectious disease specialist, and he is the head of our isolation facilities in St. Lucie at Harrison's Point. Dr. Forde is known for his openness and simplifying the information, and I can tell you that all Barbadians, we have the utmost respect for Dr. Forde, and we look forward to hearing from him, and he will be answering some of your questions. In addition, we also have Sandie Field-Kellman. She is an educator, and Sandie is going to talk to us about the next school year. The next term is September. What will school look like, and her thoughts on that. And we also have, and I hope you're here and you're listening and you're telling your friends to tune in, because we have Mary Clarke. Mary Clarke made her contribution at the Town Hall meeting on Monday at the Dighton Griffith School. That contribution made its rounds on social media, and we will be hearing from her. So we welcome your calls and comments, and we're asking you to kindly give us a ring at 228-5563 or 228-5562. If you want to send us a WhatsApp message, it's 228-5562, or log on onto our Facebook page and put your comments there, CBC Barbados, and we certainly will share those comments and your calls with our guests so that you can get some answers. When we come back, we will be speaking to Dr. Brian Charles. Welcome back to Face It and Fix It. We have with us Dr. Brian Charles. He is a specialist emergency physician. Dr. Charles is currently joining us from California, I understand, so I want to thank him. We know it's pretty early over there, So if it's looking kind of dark, Dr. Charles is up in California and he's joining us. Dr. Charles, how are you and how was the flight? The last time we spoke, I believe you were in Barbados.
Yes, I was. Yes. Good morning, everyone. Good morning, Joy. Good morning, Barbados. Yes, happy to be here with you.
Great. We know you have several colleagues around the Caribbean, and there are some concerns in various Caribbean countries, Jamaica, Dominica, Grenada. Tell us what is happening in those other islands as it relates to the pandemic, and what are your colleagues telling you about the Delta variant, for example, and if it's present in these other countries?
Yes, there are two things that I've been noticing over the last maybe week and a half. The first one is, although we've been speaking about COVID fatigue and that we have been counseling and trying to band together as a team of frontliners, I've been noticing more and more some frustration from the medical fraternity in terms of handling this upsurge in COVID cases. And in fact, what's been happening is that we have had to, speak to some of our colleagues and say, listen, because we're not vaccinated as much as other countries, we should be expecting the surges that we are seeing, and that we should be prepared, to handle it as much as possible. Take care of yourselves, and to, try to help those who have not been vaccinated, to give them good information to make the correct decisions going forward. I make specific reference to uh, email yesterday, I think, or day before yesterday, where a colleague, said, I'm just losing it. People are coming, they're not vaccinated, they're coming with severe illness, and it's very hard to maintain your composure. And though we haven't seen this as much in Barbados, we are a little bit fortunate. It is affecting persons in Jamaica and other islands as well. And just very recently, you just mentioned the surge. Jamaica has been inundated, as you would have seen from the news. Bahamas is not in a good place. St. Lucia is seeing about, I think, a 29 or 30% positivity rate. Dominica has just had a level 4 advisory from the US because of explosion of cases. And this is what we know, how we know the disease, well, the virus spreads, and we have to try to contain it. This is very fortunate. We have a very good health infrastructure. Our public health system is very robust, and we're keeping things at bay right now. But we have to really control, our activities and risk for virus at this point in.
What do you what do you think about the responses? I don't know if you have been listening to the town hall meetings, but if you in Barbados, but there's a lot of pushback. Not a lot. I can't measure it because I'm not sure if it's 50-50, but we've had some pushback. What are some of the concerns that you believe that is creating this hesitancy? What are some of the
Yeah,
concerns?
yeah, yeah, there is a fair degree of pushback, and it concerns us and the medical fraternity because even places where there is a high level of vaccination and hence some degree of protection, for example, the US, they're seeing, massive surges in Florida and in Texas, and that is really because the spread in the among the community. Now, remember that the vaccination prevent us from getting the virus, but it prevents us from getting seriously ill and dying, and it also reduces the transmissibility somewhat. What we're finding now is that because of the spread of the Delta variant, that persons now, the health systems are becoming a little bit concerned. And this is why you would have heard from the press conference yesterday from the US that they are advising a third booster now to persons 8 months after the first dose for the viruses that they have here in the US. So the pushback that you just mentioned is real, and the reasons for it, there are many reasons for it. Basically, not trusting the vaccines at this point in time, although we've been telling the general public that vaccines have been here for a long time. This is not a new vaccine. It is not an experimental vaccine. Yes, the CDC has given it only emergency authorization use, but that's because it's still early in the game and we can't wait for more people to die. More than 4.1 million people have died of COVID. So we have to use something to fight it. And those vaccinations, as well as our restriction in activities and face mask and sanitizing and social distancing. So there is some pushback, Joanne, and it's very real, but we're trying to address it.
Well, here's what we normally hear. Old people are dying all the time. Why not talk about the diabetes and the strokes and the heart attacks? And what are the statistics on those? And this is my take, and hopefully you would tell me if I'm right or wrong. You can't share your heart attack. You can't spread your heart attack. You can't spread your diabetes. You can't. You just can't. You can manage them. You can manage these diseases. Yes, we should be pushing how to prevent, but we can't push how to prevent for people who already have. So we have to manage those. When a person catches COVID and happens to be your caregiver, doctor, or nurse, and that individual has to tend to you and is not vaccinated and they're from the medical fraternity, the oath that they took will then be somewhat compromised because you're to do no harm. And it is against this background that, and I speak in particular now to the healthcare caregivers, nurses, orderlies, doctors, nursing aides, all of these people that have to deal with people who are ill. How do you not make the right decision in a situation like that? Because you have decided, this is my career, I want to save lives. But you not doing something to save yours or even to protect yourself and that person contradicts the whole thing, you know. How do you do that? And there are people right now in Barbados, and we have some statistics that there is a percentage at the QEH not vaccinated and some other private medical facilities. How does this happen, and how can we talk to them a little bit more? Because again, you're saying you can't mandate, but I'm saying that maybe we can't mandate, but can we mandate healthcare workers in any country? I hope I haven't put you in a position.
No, I mean, I've understood the rationale for persons to be hesitant and what I call reluctant for the vaccines. With regards to the healthcare workers and other frontline persons, there are some ethics, especially in medicine. There are ethics that we need to follow, and the number one ethic is one of autonomy, which means that a person has a right to choose what they want to happen to their body. And it is on this basis people are saying, well, look, I have to make my decision to say that I want to be vaccinated or not. So that's the ethic of autonomy. But then there are other ethics, as you just mentioned, which says, you should always do good and never do any harm. So there is that, and if you are exposed to COVID and you are not vaccinated, you can do harm innocently. You don't, I mean, this is not done on purpose, but you may not be sick, or you may be asymptomatic, but you could be very much a spreader to someone else who is vulnerable. And as you know, the healthcare workers, they deal with the elderly, they deal with persons who are immunocompromised, they deal with persons who have chronic illnesses, and they are the ones who can spread to others. But we have to balance it. We have to balance that decision for the autonomy versus that decision on whether or not we can, we are doing any harm. And though I do understand, yeah, go ahead, sorry.
No, go ahead. We have a caller, but
so
go ahead.
I do understand the healthcare workers, they're concerned about vaccinations and doing, they're not sure what it will do, et cetera, et cetera. There's also the other aspect, your clients, your patients, the persons that you care for. We have to be responsible. And I'm not bashing anyone. I do understand the freedom of choice. I do understand it, believe me. But I just want to say that, if we are making other persons to be at risk. We have to consider that, and we have to decide which way we want to go. And you did mention some statistics, and I will be the first to say that I am disappointed with those statistics, because I thought that more persons in the healthcare environment would have been vaccinated, and hence would have offered that level of protection and responsibility to the community at large. But at the same time, we can't force them, and we don't want to be in a situation where we have to force them.
Well, I think at some point we do have a caller that we do have to have a discussion where we can find a balance, because realistically speaking, there are some people you will never change their minds, and then that's okay. But we now need to have a discussion where we can create a balance for persons who want to and persons who don't want to, so that we can all live in a safe manner. But we're going to take this call. Good morning, Face It and Fix It. You're on the air.
Hi, good morning. Good morning to Barbados. Good morning to you. Question. I'm confused. Why? Going around, most of the people that are vaccinated are saying to the people that are not vaccinated that don't come close to me, they don't want to be infected. You know, it's confusing because it makes me wonder about the vaccine. Is it ready or is it not ready? Because if you're going to be vaccinated and you're still running scared, I don't know. And they're dishing out this thing like, this is what they're saying, what some people are saying. When we had vaccines with polio and the other vaccines from when we were children, and what's happened with this one where you can't take it. But it has been proven that those vaccines, especially the polio one, worked. You know, this vaccine seems to me that it's still in an experimental stage, and it's difficult for people to live with that. It's difficult for, you know, what happened to black people when they vaccinate them in Africa. We know what happened to us in the Tuskegee, if I'm saying it right, in America with the syphilis. And I know black people will be running scared because we don't have no faith in it right now. I know years ago, our parents, our grandparents were ignorant to the facts or to the sciences. And, you know, they give in to all of that because everybody wants to be better. But now people are more open up. People are more educated, even if they're hearing some good and some bad. And people are more accepting to the natural medication, natural medications and herbs and so on that do us good. So my confusion is, why are the people that vaccinated are so scared? Right now, America, Pfizer is sending out another booster, a third shot. You got to understand these things that people ain't got enough faith. A third shot. You know, so that's my question. Is the vaccine ready, or why are we scared if we are taking it?
Okay, Dr. Charles.
Okay.
Very good contribution, ma'am. Thank you so much.
Okay.
Absolutely. And thank you very much, caller. Those are very good points. And I don't know if you're going off the line, but I would like to address your points bit by bit. And I hope that you can, you know, remind me if I've not covered everything. The first thing is, and you started by saying the vaccinated people are telling people not to come near them if they're not vaccinated. I would like to encourage and plead to persons. It is not a matter of me vaccinated and you not vaccinated, and there's a division and there's discrimination and there is you know, a separation of anything. Please, we don't need to come to that unvaccinated versus vaccinated. We need to think together so that we work towards removing this disease. There are some people who are not going to be able to take the vaccine. There's some people who don't want the vaccine, and there are others who have taken the vaccine. It doesn't make us any different. We're all, you know, human beings, and we're all trying to fight this however much we do. So that's the first thing. And I'm hearing this more and more as, I don't know if as we're trying to educate the public, we're hearing this unvaccinated versus vaccinated, and this division is coming. And it is even, you know, I'm right now in the US right now, and it is prolific here. There's actually something almost like, you know, prejudiciary health discrimination. And, you know, I'm saying, but this is not needed. You know, if I chose not to get the vaccine and I've made that choice, on on informed, good information, it's my decision, then I must respect that. So the vaccinated versus unvaccinated argument, I would like to dispel that right away. The second thing you mentioned is that our forefathers were not as maybe educated or informed as we are right now, and they decided to take the vaccines because they were probably not given any choice, and that's not really true. Those vaccines that we have gone through the same rigors that as the one that we're using right now against COVID. The vaccine you mentioned is experimental. It's not experimental. The vaccine works in a certain way. It does not work to prevent you from getting infected. So persons who are vaccinated will still get infected. And interestingly enough, with the Delta variant, they can still spread it more because there's more of the virus within your body. And
With the Delta
so
variant,
that's
you're saying that they can spread it more. And because when we come back after the break, I really need to ask you this question about the viral load for the vaccinated and the unvaccinated. But we will be back with Dr. Charles after the break. Welcome back to Face It and Fix It. We are currently speaking to Dr. Brian Charles, Specialist Emergency Physician. Dr. Charles, can you continue? Sorry we had to break there, but I want you to continue what you were saying, and then we can talk about the viral loads, because we had to interrupt you. Yes.
Yes, so that the call, I was referring to what the caller said. So she made several points, and I've taken the opportunity to write down some things that I wanted to speak of. The Tuskegee experiment, which you mentioned, was an unfortunate point in history. It has no relation to what's happening right now. And I do know we cannot ignore history, but at this point in time, history is not repeating itself. This is not an experiment being done on one sector or one race of the population. COVID is affecting everyone, and it's a global pandemic. So we have to address this globally. It's not one versus another. The vaccine was not made for one set of people. The vaccine has been used throughout the world in every single race and every single ethnicity. So we need not to be confused about that in terms of the experiment. You mentioned also what to those persons, Black people who are getting the vaccine. And, just like myself and everyone else, all over the world, Black people are getting the vaccine, and there's no difference in the vaccine that they're getting versus the vaccine other people are getting. And there's no difference in the effects at this point either. You mentioned the third booster, which Americans just authorized just yesterday in the press conference. The reason for that third booster, and let me explain it very carefully. As long as the virus is allowed to exist within a host, and this is a human being host, the virus will mutate, the virus will change. Some of these changes make the virus less effective. Some of the changes make the virus more effective. The Delta strain is one such virus, one such mutation that has made it more effective. It is more transmissible, which means that it can get from one person to another person much easier than the original strain. Also, it is affecting persons in that it is making them more sick, and as opposed to the first strain, it's affecting the younger people more as well. This is very concerning because some of these younger people have not been vaccinated. And this is why we're seeing the explosion in the US right now, because we are seeing a lot more younger people being hospitalized, admitted, severely ill, and dying. So it is not for you to be confused of being vaccinated versus vaccinated. It's for us to, try to impact the information about what's happening with the vaccine. And Joanne, you were mentioning about the load, if I may, at this point in time. The Delta variant seems to have such a high level of reproducibility that the number of viral particles in your airways, in your upper, your throat, is a lot higher than with the original strain, which means that there is more likelihood of you spreading it than the original strain. And this is even with the vaccinated people. So because of that, the CDC has recommended that a third booster dose be given. And it's not because the vaccine is not working, but it's because we are allowing, or we have allowed, the mutation of the Delta variant to come up. And if we don't tackle it very, very hard, there's likely that, there will be more mutations. As there's a host, the virus is going to mutate and change.
But I think that caller, as well as most Barbadians and people even around the world that are hesitant, one of the questions that she asked, I'm vaccinated, let's just say you're not. I'm telling you, don't come around me, but yet still I'm the one with the protection. People are concerned as to why unvaccinated people are worried about vaccinated people. Then they're saying, but you could catch it too. So we have the same level of viral load that we can spread. But there's a difference from what I understand. I may not die or get sick or hospitalized because I am vaccinated. Your chances are higher. 2, the length of time that the viral load can stay in my body as a person who is vaccinated may be shorter than the time it can stay in your body to transmit as an unvaccinated person, maybe longer. Am I on the right track or am I way off?
You are on the right track. You are definitely on the right track. And this is the reason why, Joyanne, we are vaccinated and many people are not vaccinated. We have to continue with the non-pharmacological methods of controlling this pandemic. The face mask, the social distancing, the frequent hand sanitizing, and respiratory hygiene. The effect of you being vaccinated does not mean that you cannot spread it, but that's also saying that it's unlikely that you will get severely ill. If you are not vaccinated, you will still be spreading it, but you are giving yourself less of a chance of becoming severely ill. So hence, we all have to practice the same non-pharmacological methods. We all have we can't say, hey, you are vaccinated, don't come by me. You are unvaccinated, don't come by me, or whatever, but we still have to protect ourselves and protect our loved ones.
But a vaccinated person, as we all know, would carry some, obviously not 100%, as we know, because there are COVID breakthroughs, but a higher protection. But what people want to know is, okay, you guys want all of us to vaccinate, we're all not going to. So can we not live with the fact that can I not go around Joyanne? Joyanne has to be more worried for me, meaning the individual, than they don't have to fear me. I don't even have to fear them. They have to fear unvaccinated people gathering together in large numbers. So I think the question is that people are like, because we've heard vaccinated people say, listen, if you're vaccinated, don't come my way. So then the unvaccinated people say, but oh, hold on a minute, what's your problem? You have a vaccine, why are you so worried? So you see the conversation and the narrative, and I think even coming from the top worldwide, people are scared, period. Unvaccinated people are scared of the vaccine. Vaccinated people are scared of catching COVID. The common denominator here is fear. What we are missing is information that is not missing. Let me rephrase it. Is for people to listen to the correct information from the right sources. This is how this whole confusion started through one thing called social media. One thing called social media started this, and probably some other media houses too that may have an agenda. But maybe we need to have a program, and I probably will tell the producer this, on how to spot fake information. Who do you take the right information from, etc. Because this has gotten out of control, and not the virus itself. It is the information, the attitude, the way how people feel towards everything has gotten out of control with this COVID virus. So what I say about us not having to fear, and she was asking that question, why are vaccinated people so fearful? In your view, what is it for a vaccinated person, based on people are telling you they're vaccinated, why are they so scared?
Yeah. So what I have found is sort of the opposite. I have found, for example, in my travels.
Doctor, we want Dr. Forde to join you. Dr. Corey Forde is here. We want him to join you too, as well, in this conversation. So I want to welcome Dr. Corey Forde, but I want you to continue with your conversation.
What I have found in my travels is that persons for example, in the UK and in the US, where there's a much higher level of vaccinations, persons are becoming so relaxed. And you would have seen, for example, yesterday, the governor in Texas tested positive for COVID. And this is 4 days or 5 days after he was at a function, persons socializing. Everyone was vaccinated, but no one was wearing a mask. So what I have found is that the vaccinated people have now thought that they are completely protected, relaxed their guard, and they have found that they think that they need not to protect themselves. I have not found, locally, and this is in Barbados and in the Caribbean, even though there may be this fear of unvaccinated people, what we need to do is to dispel this fear and to make people understand that, let us try to provide good, solid information as to why they're vaccinated and why they need not to fear persons who are unvaccinated, because everyone is practicing the good non-pharmacological methods of controlling the disease. And that would get us forward.
All right, we also want to welcome on the show Dr. Corey Forde, infectious disease specialist and head of our isolation facilities at Harsons Point. Dr. Forde, I don't think there's a doctor right now in the planet that envies you, but I know a lot of people do respect you, and that also of Dr. Brian Charles, and this is why we welcome you on the show. Yesterday, Dr. Forde, you made some excellent points, but I know that you were not able to cover everything, and I want to take us back to the town hall meeting and with a contribution you made when it came to children, and that individual asked you about your thoughts about if my child catches COVID, what happens? And before you answer that, I know all of Barbados probably know by now, I talk about my daughter Sky, who has Down syndrome, and God forbid if Sky was not vaccinated, and she is, and she had to go to Harsons Point, and I was not positive. I'm not allowed to go down there and hold her hand. I'm not allowed to go down there and say, Sky, don't worry, mommy got you. I'm not allowed to do that. My daughter, unfortunately, God forbid, if she had it and she had to go, she'd have to die alone. Now, Dr. Forde made, not maybe that same way I put it, but he spoke about that, and I want to give you an opportunity, Dr. Forde, maybe to address some issues that weren't addressed at the town hall meeting, But I want you to start there as it relates to the children, now that we have the Pfizer vaccine and the concerns that parents now have.
Yes, good morning, Barbados, and good morning to you. Good morning, Brian. Doing a fantastic job. I just want to support everything he's said, and someone who's taught me from medical school. So I'm to be here today. So just
He's
thankful for
telling out
him.
your age, Dr. Charles.
He is, he is.
Sorry about that. That was not the intention. Just to thank him for all of his efforts and etc. Yeah. So I think, and I've listened quite clearly. Just if you give me a chance, I just want to address one of the previous questions. And I know that it seems as though there's a battle between the vaccinated and unvaccinated. It really doesn't have to be frankly honest. But just to explain a little bit more, and then I'll address your question. You know, why it is so important that people who are unvaccinated consider certainly being vaccinated. The longer we have the virus running rampant, the greater the chance of a spraying a variant that will not even be sensitive in terms of the vaccination process to the vaccines which are available. Hard and soft, that's really what it is. The longer we have the virus replicating in the community, among persons from all over the globe, the greater the chance of a spraying a variant that might be problems for us. And I say that in the context of saying this, look, I think the world has made two major mistakes in this pandemic. One, and I'll say, I mean, frank, right? Globally, in terms of vaccinations, I honestly believe that the world's distribution of vaccines has caused us more trouble than not. And I think if there was more equitable distribution, giving people a chance to be vaccinated, then maybe some of these variants that we've even seen may have never occurred. Who knows? It's just a speculation. The other one is in terms of travel, but we're not here to discuss that today. So I'll just move on exactly to what you particularly spoke to me. And it's the reality of things. Yes, if your children, you can come to Harson's Point, your parents can come, but they're obviously putting themselves in a risky situation as well in terms of getting COVID. Nobody wants to see their child die. You know, like I said last night, and I'll just say it again, just as simple as I said last night. The reality is this: you have a kid, you know there's a vaccine. We know from points. I'm going to give you some percentages. We certainly for Delta, and I'll be specific to Delta, I'm most worried about in this country at this point. We know for sure 93%, at least 93% of people who get Delta will not end up hospitalized, and that's across the board, adults or children. So it's 7% might get into trouble. You're never going to deny that. There's no vaccine on earth that's 100% effective, and we know that. And if we even looked outside of Delta, it's even better in terms of percentages in terms of you ending up in a hospital setting. But what about the other end? What is your ability as a vaccinated person, for example, to get infected or to infect someone? It's about in the 60s, right? So that's a bit down from what it was before, and we understand that, right? But I think the problem is the other end, that we know if you get COVID, this is what we actually know for sure. So we know if your kid gets COVID, the kid can get sick. And in Barbados, use our own experience, right? Use the Caribbean's current experience. And then one can see that risk is actually there. You don't want your kids to get sick. Your kids want to have parents for until such time.
Ever.
So I think these are things. These are these are things that we really desperately need to come to grips with. It's a quite challenging situation for the healthcare workers. It's for adults, we know, but for kids, it's heartbreaking when you see kids coming and being sick. And we had that at Harson's Point. We had a kid who was actually intubated, meaning we put a tube down the mouth and we put them on a machine, and that was their life support. We were able within 3 days to get them off, which I always want to congratulate the pediatric team. That was an amazing feat. But you never ever want to see those sort of things in Barbados. That kid could have died. We had the death of one kid. It wasn't while they have COVID, it was after. And these are things that we know. So why not consider that? Why not consider vaccinating your kid? Because you know that these complications can happen even after COVID. right? Everybody's talking about, well, you take the vaccine, we don't know what's going to happen after. But I can tell you, after COVID, these may be the complications, and they're unpredictable. I can't tell you if they're going to happen or not, right? I'm not God. I can't tell you if they're going to happen, but I can tell you that they can happen, and we've had enough cases globally, right, to show that one needs to focus on these particular areas. So, yes, I would advise you, to make sure that your own child gets vaccinated. I'm not here to say anything should be mandatory. I'm not getting into that conversation at all. What I'm saying, I'm here to give you good medical advice to allow you to help lead yourself to the appropriate conclusion. Let me just
Well,
tell you this before talking. One
well,
last
that's,
point.
go ahead. Go ahead.
Fear is real. Fear of the vaccination is real, right? And I don't think anybody should get knocked or get called an anti-vaxxer because you're fearful. It is okay to be fearful. I am the infection control doctor. I was one of the first person in this country to get the vaccine. And I am telling you online now, I was fearful at first. If I told you it was not, I would be lying. My family, my sister was crying. Everybody was afraid, right? But I think there's much more evidence now than even when I took the vaccine to make me know millions and billions of people have taken the vaccine globally. And now I understand, where we're at. So I just wanted to share that on personal note.
And I think people respect you for that, and this is why I think they love you so much. But we were going to come back with Dr. Brian Charles and Dr. Corey Forde after the break, and I'm not sure if Dr. Charles has to go, but we'll find that out during the break. We'll be back. Welcome back to Face It and Fix It. We are speaking with Dr. Brian Charles, Specialist Emergency Physician, and Dr. Corey Forde, Infectious Disease Specialist and Head of the Isolation Facilities down at Harrison's Point. Dr. Forde, I've never been to Harrison's Point. I don't even want to come to even tour it. But I know you're doing a fantastic job there with the entire team because no man is an island. But what is the situation right now at Harrison's Point? Because last night at the town hall meeting, we saw you change clothes and said, I have to go. And I'm sure that's the story of your life, having to deal with possible emergencies down at Harrison's Point. What is the situation there? And can you give us a little breakdown as to where we're at? How many adults? Do we have anybody on ventilators, etc.?
Yeah, thank you. Thanks, Joyanne. So I welcome you to Harrison's Point. Actually, it's no fear. I keep saying it's the safest place in Barbados where COVID is concerned. We have some very rigid protocols. You would know you've never heard that there are these massive outbreaks of COVID at Harrison's Point, the one place in the country where you find all the COVID of all the different variants you can find. But that's just a stinging point there before I get into the data. And I just want to start off by saying, look, Harrison's Point is a team effort. It's not Corey Forde. It's the full team: medical, nursing, procurement, orderlies, kitchen, housekeeping staff, which I really have to applaud this morning on national TV. Right? Don't forget them. They are an integral part of the working of our facility. And the orderlies department, another integral part of the working of our facilities. Often they interact with patients more frequently than even sometimes physicians, and they've done quite well in that. So I really have to take the opportunity to say that before I even get into numbers. Yes, and yesterday we had a bit of a challenge, and it really speaks to I'm not about fear mongering or making people afraid, so they respond in a certain way. But I think people also need to know the reality of the situation. And I always say, just tell the truth. If you get something wrong, tell the truth. If the numbers are bad, tell the truth. If you have variants of concern, tell the truth. That's always how I operate my life, along with using God's guidance, managing patients and making decisions sometimes. So I just give you a great idea. I'm not going to give you a full long rundown of what's going on, but I'm going to give you some key points. Look, a few days ago in our primary isolation, which is our ICU, we didn't have that many patients. We had like 2 patients or 3. Within the advent of the last few days, when the numbers started to increase, I saw 2 key things which were worrying. We saw the amount of people being admitted to decrease. So we now have a total, last night before it was on the call, there were 12 people. Now there are 13 persons. Of those 13, 4 of them are young adults between the age of 17 to 40. That is extremely worrisome. To me, that almost spells the idea of Delta. Delta likes young people. And if I just give you a little bit, if you allow me to give you a little bit more information on that, I think it's very important. Mm-hmm. If we look at the data spanning from February all the way down, actually from late January, February, all the way down to present, our admissions look the same way. So almost all the admissions in the facility have been around that age group. From the age of 17 to 40, the majority of the admissions have been in that age group. And I think that that's the age group in Barbados. If I was honest with you, right, my age group, right? So if I was honest with you, I honestly believe that we need to focus a lot on educating that age group, because I think that's where we will lose it. This is the age group where people move around a lot, where people go to work, people interact, have young kids, etc. Right? And if we get it wrong in this age group, if you look at the figures, all is like telling. I wish I could project it to show you. It is telling, and this is the age group that we need to definitely focus on in country, because I think there was this belief in the first part of the outbreak, and they were correct, that many older people with comorbidities were being affected. I will shatter to tell you today, we know better now with Delta. The Delta variant is a totally different kettle of fish, if I can say that on national TV. Totally different kettle of fish. Right? It is no respecter of age. It is no respecter of person. It is no respecter of if you're from the Heights, or if you're from the Terrace, or if you're from the block. When it hit you, it could hit you and hard. And you know what? It might hit you and you might get away. Right? And the one way we know you can get away is if you're vaccinated, because the statistics say that. 93%. Shooting that at you again. That's the worst data coming out of Israel. 93% of people who were vaccinated were not able to be hospitalized. Maybe you don't believe me, right? Take a look at national TV. All the states in the US, all the provinces in Canada, all of them which were well vaccinated populations, people will get COVID, maybe, right? But they won't get sick. The hospitals are not overwhelmed. The states in the US which are in problems are the under-vaccinated states. If you don't believe that, look at India. India had a huge problem, right? And they recognize if I vaccinate my population quickly, maybe what you're seeing on national TV in India when the vaccination rates were less than 20%. You're not seeing that anymore. Mm-hmm. Yes, there are issues, but it's not as dramatic. So take that into consequence. Yeah.
So Dr. Charles actually is over there right now in California. He's that room that you see there is a hotel room, I would imagine. So he's nowhere near Barbados. What are the young people saying? Do you have any idea what's happening? The teenagers, is he saying it's impacting? Delta seems to like young people. Is that the case over there?
Yes, it certainly is, Joanne. And what Corey is saying is very true. What we're seeing is a shift now of the hospitalizations and the seriously ill from those over 60 and with comorbidities to the younger populations. They're saying here in my communication with colleagues here, that they're seeing persons in ICU and step-down units who are 30, 40, athletes, persons who are young and they never expected to be ill, now becoming ill with the Delta variant. The other thing is that what they're finding now is that the children, the unvaccinated children, now are becoming at risk. So as school is coming back for here in the US in this week and next week, there's a huge concern about those children because they have not been vaccinated, they're under 12 years old. So that is of concern. What I would also like, as Corey is on the line right now, is I don't know if you have the statistic, Corey, to say what is the percentage of vaccinated persons up at Harrison Point versus the unvaccinated. I did see something from the Ministry of Health yesterday in Barbados, I think, which gave a figure. But if you have that, it's probably best for you to communicate that. That's an important point. It's not that we're not going to get the COVID, but it's how sick we get, and just by the admission figures that you're providing could give that information.
Yes, Dr. Forde.
Yes. So all I can tell you, now I don't have that data on me. I had to mind my way to try to get on this program. But it's something I'm willing to come back and discuss, Diana, if you give me the opportunity, yeah? Mm-hmm. But what I can tell you as a certainty, for sure, since I've spoken to the country almost 2-3 weeks ago, almost 4 weeks now, there's only been one vaccinated person who ended up in our ICU. One. Right? Okay. The majority of our admissions, when we look back at this data, recently the majority of our admissions have been unvaccinated individuals. And if you look at that quota, only one of them during that course of time, with any degree of certainty, has ended up in our ICU. And I made the point for that one case, and that one case was linked. The reason why they were there is because they had another medical condition concerned about as well. And additionally, that individual is now back home with them. That person was quite ill, back home with their family, which speaks again to vaccinations. Again, if we're looking at ICU now, among that group I spoke about, just so we have a total of 9 persons who are ill. So out of that 13, and I'd say in the context of are on ventilators, and the other 5 are on oxygen. The others are not on oxygen at that point, but that might change pretty quickly. And including the one who's from secondary isolation to primary because they got pretty ill. So in context of vaccination and the figures that you need, you give me a few seconds and I'm gonna get back to you on that. Dr. Charles, a very, very important.
It is very important because it will give people a sense, and even not only just in Barbados but globally. But I want y'all to recommend to the public, because at that town hall meeting and all of them, people do read, yes, but is where the source is coming from is a problem. And as doctors, one of the things I would like to see you do is to make recommendations as to where they can get accurate information from. So I've gone on this site, and most of it comes through Facebook, but there must be some credible medical journals, things that you guys go to yourselves to get the facts that are open to everyone. Is that something you can share with us? Maybe name some sites that we can go to, credible sites that you, the doctors, go to get information, to steer people in that direction.
I have found about 3 sites that are very reliable and credible, and I tend to use these as my cross-reference sites, and they're very easy to read. The first one is bbc.com, and they have a huge amount of information on vaccines, and they are not prejudicial at all. They give good information. The other 2 sites would be WHO and the CDC.
And the CDC is American?
Is American, yes.
Okay.
Yeah, but they do have some information. Yes, right. And I also when I look at that site, I also only go for the for the data part of it. I'm not looking at the interpretation or the guidelines. I'm looking at the data in terms of what's happening for the US for vaccinated versus unvaccinated. Where are the hot spots? And that kind of thing. So those are things that you can use. I don't know if Corey has any others that he can ask the public that they can use easily.
Corey, do you have any others you want to add to BBC and WHO, CDC?
Yeah, so I think those are the major sites that persons can get credible information for. Statistics, if you're into journal reading, obviously you can look at the Lancet or British or the New York, the NEJM, sorry. So those are all credible sources of information as well, but it's a little bit more intense in terms of that. Just to give you an idea, I think the ministry presented the information yesterday up to that period. If we look at the amount of vaccinated persons, and I think there was a very, very nice picture, graphical information that came out of Bahamas, which I think if we got, guys are currently working on something like that, if we actually produce that, then one can actually see the humongous difference. So like I said before, we have a total of the current admissions in Harrison's Point about 84%. Over the period of, and I'm looking for the period from March, because that's around the time, March, April, there were 84% of persons were in the facility who were unvaccinated, 84%, and then 9% of those individuals were partially vaccinated, and then 7% of those individuals vaccinated at that time. I think the important point from that is, out of all of those persons who were vaccinated, only one person ended up in our critical care unit.
And that was because of other issues and not necessarily COVID.
She had another issue going on with her. But I'm going to tell you, to be fair and honest, it does not mean because you're vaccinated that you might not get ill, because it's still not 100% efficient. But not being 100% efficient means it still gives you some element of protection. In other words, although in her case, because of her underlying condition, the vaccine may have been challenging in her particular situation, she was still able to make it out. I cannot guarantee that for someone who is not vaccinated.
So we're living in a society, as we said, we don't want to see the division. You doctors want people to live. But what if the situation gets to the point where we know that you cannot change every person's minds, and there are some people, we have to live with the fact, there are some people who will not take that vaccine. What can you recommend in the arsenal that we talk about, vaccine, masks, distancing? Will those persons be okay with the Delta variant, wearing a mask, physical distancing, and sanitizing as the option? Can you comfortably say that can help? Because the Delta variant you're saying is very contagious. So are you saying that even though I'm wearing a mask, I can still catch this Delta?
Yeah, so you remember that you just wearing a mask gives a level of protection. Frequent sanitizing gives a level of protection. But how SARS-CoV-2 spreads is, you can touch hard surfaces, and then you touch your face or you touch your eyes, or you're out in the pub in a closed space and someone sneezes and it comes into your eyes. So you still are at level of risk, but you're much less likely to catch it if you're using these practices. And that's the message, really. And that's why I said earlier in the program, even if you're vaccinated or not vaccinated, you still have to do those measures to protect yourself, because Delta is, between 8 and 12 times more contagious, and it gives a more severe level of illness, and you have to use those measures to protect yourself. And also later on in the program, I would like to say to Joyanne that I have just received some information from one of our colleagues in another island who is concerned of something else. And I'll bring that up a little later.
Okay. So Dr. Forde, I want to ask you, everybody's talking about Delta. Does that mean that the other strains somewhat become less and less?
No, everybody's talking about Delta because that's the in thing. It's like when, you bell bottoms were the in thing. Everybody wore bell bottoms, but people were still wearing normal clothes.
I think I still have a few in my wardrobe, so hey.
Don't worry, just keep them in. It's going to come all the way around.
It's going to come all the way around.
But the point I'm making there is this: look, Delta, because Delta is around, it doesn't mean that Alpha has disappeared. It doesn't mean that Gamma has disappeared. And this is important. This is how virus. It just means that they've become the predominant virus that's circulating. Additionally, I think most people on the call may have heard about Lambda coming out of Peru. If you're listening to me today, coming out of Peru, for me, it's probably even more worrisome at this point. And people are not talking about that. So I think these are the key viruses which are circulating. The previous virus and the one which all started this is probably even still circulating. But what we know about Delta at this point certainly is more worrying. And I'm just going to juxtapose that on this particular issue because I always like to bring things back home to us right here in Barbados. And if we look again, most recently, we've seen that people are now coming in with two key things. So most of Barbadians were presented. If we look at the numbers, it's just quite different. It just sends off an alarm bell in my head because I monitor all of these things on a daily basis. More people are symptomatic. If we look back from March to now, it's kind of changing the tide. So most people are coming in, including that group, which are unvaccinated, are presenting more symptomatic. And I'm actually looking at the data as I speak to you. And then even now going into the months of April, that's exactly what we're seeing. But that's now coupled with the one thing that worries me is that we're seeing people presenting certainly with what we call, to throw medical terms out, but CT values. So the amount of virus that we're finding certainly within their systems is much higher. What does that mean? That they're possibly more likely to get into trouble, especially if you're unvaccinated. But your ability to spread to someone else is exactly what we're worried about with Delta. Is real, and that's actually quite worrying for me. And that's why last night I spoke the way I did because I keep telling people, you hear me speak about something is because I honestly am almost sure that we're going to get into trouble if we don't pull back. And I think the point that to finish off, the point that Dr. Charles has made, I just want every single Barbadian to pay attention to. You may be mask weary, right? But if you're not vaccinated, that's one of the key things that you might be weary or still considering vaccination. But you see, washing your hands and appropriate hand hygiene is probably the only thing that can save you from being hospitalized if you get COVID, right? You may be mask weary, but taking the appropriate distance, right? Or you may be vaccination weary, taking the appropriate distance away from individuals and not bunching would be the only things that will be able to keep you from hospitalization. And if you get it wrong, right, you could end up in a hospital and be on a ventilator or be on oxygen, and you don't think about. And none of those things might happen, right? But you end up with the long-term complications of COVID, which are just as worrisome for us, from hair loss to neurological problems to psychological problems.
Well, I also heard erectile dysfunction. Is that true?
You got that right.
No, okay. Well, seriously, that's one of the effects of long COVID.
Yes.
So men, I think we need not to go any further with at least convincing the males the importance of vaccinating. I mean, I figured that if it had anything to do with anything sexual, truthfully, it might have pushed a lot more people in the direction. Sad, but that is human nature. It might have pushed more people, but coming from Dr. Forde and Dr. Brian Charles, because he's shaking his head, apart from hair loss, as you're saying, and so many different things, erectile dysfunction is part of the effects that you can have after having COVID, if you survive it, after having COVID. Someone is asking on WhatsApp, I know we've heard this question, probably asked and answered, but of course we want to repeat all the time, what is herd immunity? And if we don't reach it, what will happen? Dr.
Corey, you want to take this one? I answered it last week. So
Dr. Forde?
Yes.
All right, I eased this now because I'm not going to let Brian take that, but that's okay. But I mean, to make it very simple, if I have 10 people in a crowd, yes, trying to make it as simple as I possibly can for everybody who's listening. Even the little pediatric kids can understand. So you have 10 people in the crowd, and one of them is positive for COVID, but all of them but one person in that crowd are vaccinated, right? It might still get to that person, right? But it has to hop too many people to get to that person. But if they're all vaccinated and the risk of transmission to other persons is decreased more than normal, then it will take a while to get to them. If I have 1,000 people and I have one person in that crowd who's positive, but 3 people decided, we don't want to take the vaccine in that crowd. To get to them, it has to get through all the other people to transmit across the lane. So what herd immunity is exactly that, right? If we have the majority of our population vaccinated, then the disease can get to you. But Delta has thrown us a curve, which has made the ability to achieve herd immunity a bit more trickier. And that is because, of course, you can still know people, although that person who's not vaccinated or had the infection, and they pass it to the other individual, even though they pass it to that other individual in the crowd, the people who are vaccinated can spread it among each other. The difference is the length of time that they have in terms of that virus replicating in them is much shorter. The length of time being shorter means that less time or less chance that particular individual has for spraying a variant which can be problematic. That is the big difference between that person and the person who is not vaccinated. And if you're not vaccinated and that virus, just what's going on around us, right? And that person keeps replicating, we might become famous globally, and it not because our rates of deaths are low, but because we spring a variant out of Barbados. So some hard decisions have to be made. I can't force you or hold you down and tell you to take a vaccine, but I am sure telling you today that you need to seriously consider this in the context of what's going on globally. You don't have to look too far to try to make that decision. Take a peek out at St. Lucia this morning. Take a peek out at Dominica this morning. I don't even want to call Jamaica, right? Because that's devastating because of a few nurses that I knew have died. And that's where we get impacted as healthcare workers. So the decision, can I say that, Joanne? The decisions that you make, right? Sorry, I'm just going in passionate mode because I have people that I have to be responsible for. And decisions you make, it can affect our own livelihoods. And I saw somebody type last night, if I'm permitted to say this, type in the chat last night, but that's the decision you all guys made to be doctors and nurses. And that was a hard one. I thought it was right, but that's okay, right? Everybody is subject to their opinions. But I think you have to understand that we also have families who are scared every time we go out, and we also have kids, and people need to continue their livelihoods. So I think, in making your decision, also consider the responsibility you have to others around you, whether it be your family, but also for those persons who are trying to save lives of people who might get ill. Knowing that one of these days, some of the people who might be talking and screaming, it may be you. But you know what? We are still going to put in our best effort despite the choices that you have made. And I need to let Barbadians know that as well. Nobody will discriminate against you, certainly medically, because of that. That would be totally wrong.
We have a question. Then we have to go to break, but I guess we will ask it before we go. What is natural immunity and how do we get there? Because I know there are people who had COVID and they're thinking, I'm not going to get it again. I'm immune. Is that true? So what is natural immunity? And then we'll go from there with who had COVID and if they're immune or not.
Yes. So persons who got natural immunity, if you've been exposed to any agent and not only COVID, you mount a defense against that agent to protect yourself. So the army of protection that the body can offer to a foreign agent is called a natural immunity. So that's what natural immunity is, to fight something else that's foreign. The thing about natural immunity and acquired immunity from vaccines is that sometimes the immunity wanes. In other words, as time goes on, the level of protection decreases slightly and more, which can make you more susceptible to the same foreign agent again. And that's the concept. That's why booster doses are needed for certain foreign agents. So natural immunity, you get it. Yes, you may be protected, but we don't know how long you're going to be protected for. Same thing for acquired immunity. So that's really
So
immunity.
there could be people right now, who, and I'm not saying that, because we got to balance it, that had COVID, but might not, for some reason, get it
Yeah,
again.
yeah, we've had,
Yeah,
and I always say go back locally, right? So we've had cases of reinfection. Yes, we have. This is the point that reinfection can also depend on the type of variant, as we told a different variant. Very early in this pandemic, when we were trying to figure out if people can be reinfected, which changed the course of things again. There were some cases out of Asia. There were one or two of Asia where a young man got infected within 2 weeks with a totally different strain. It is possible, and I think there's this fallacy about, oh, let everybody get COVID. But lots of people are going to die in Barbados if you just let it just run. There's a sheer amount of comorbidities, the sheer amount of elderly people. Basically, you're saying to just give up, and I don't think that we should ever be at that
Well,
corner.
I think if people want to live, I mean, yes, a lot of us do some bad practices and so on and so forth, but I believe it's the space of time that COVID kills is a greater concern. In 2 weeks, you don't have a lot of time if you are going to pass by COVID. But the other thing too, and I want to say this, we all have to make decisions. And again, and I said this before and I'll repeat it again, I often talk about my daughter. I'm proud of my daughter. She has Down syndrome. She's born with 2 holes in her heart and 1 valve. The point is, I was given the option to leave it. We can't do anything about Down syndrome, they said, and you're going to have to pay for the surgery and you didn't have any money. I had that option to wait it out for my daughter to get something called pulmonary hypertension, and then there's no surgery. That's it. Maybe 2-3 years she's gone. My daughter is celebrating her 22nd birthday in October. She had the surgery, and I knew the risk, but yes, the outcome was better because it was about 95% successful. But there was that 5% that she could die on an operating table. And I say this without fear. I know sometimes I get a little overwhelmed, but I would rather have lived with the fact that my daughter died that day by me trying to get her there and to a table than to sit back and do nothing about a situation that you can do something about. So I'm hoping that Barbadians would understand there are tough decisions we all have to make in life, but we have to weigh the options. We really do. And we got to take a chance. And right now, science says the vaccine is your best source of defense. It really, really is if you want to live. And I'm sorry I got to get emotional with that because it's true. We all have to make tough decisions. We all do. And we're all scared. And we're hoping that this will help. And it looks as if it is helping. And I'm hoping that with you, Dr. Forde, and I have so much respect for you and Dr. Charles, because I know you were in charge of the emergency room at A&E at one point at QEH, I believe. I think you were there. And these guys have talent. These guys are here to save your lives, for crying out loud. Why would you want to put them and their families at risk? Why would you want to do that? You know. So anyway, we'll be back after the break, and we want to thank you so much. Final words?
Well, I have to say that what's happening in the Caribbean in terms of the
Right. There was
explosion
something
is
you wanted
very
to say
concerning.
quickly. Yes. Mm-hmm.
Yeah, very quickly. It's very concerning to me in that, remember, COVID is not the only thing that we, the medical fraternity, are dealing with. We have the normal other things that still are there, appendicitis, and heart attacks, strokes. When we divert all our resources away from that to deal with COVID, those persons who have non-COVID related illnesses are suffering. This is what's happening in other Caribbean countries right now. We are fortunate to have had Dr. Forde and the government provide isolation facilities and everything else. If we don't manage this right now, we're going to become overwhelmed, and the non-COVID related medical illnesses, emergencies, are going to be really, really problematic. So please, let's do the right thing and let's stay the right way.
And Dr. Forde, final words to you?
Final words to all Barbadians is this, right? The decisions that you make in life right now can affect the future of your children and of the country. I'm not here to force anyone to be vaccinated or even suggest that, but all I'm going to tell you, the decisions that you make would impact this country in terms of its healthcare system, in terms of deaths across the country for those who are vulnerable and cannot survive, but it will also impact the future of your children. The cost of healthcare, if this ramps up, would be significant, and the deaths which may occur as because of decisions we make can be crippling. So I want to advise all Barbadians today, apart from saying that, to advise them to continue to wear your mask appropriately, to use your appropriate hand hygiene, and to get vaccinated. It is a masterful approach when we put all of these things together. If one is dropped, then the possibility of us getting into trouble is much greater. That is all I have to say.
Thank you so much, Dr. Corey Forde and Dr. Brian Charles. Thank you. And during the break, somebody please bring me a tissue, because it's touching. That's all I can tell you. What you do, we thank you, and we know people die, and but if we can avoid this type of death, I think we should try. So I want to thank you, doctors, so much, and the country appreciates all of your work. Thank you. We'll be back.
Thank you very much. Thanks for having me.
Thank you. We'll be back after the break. Welcome back to Face It and Fix It. A couple days ago, a video made some rounds on social media. A young lady, a young woman by the name of Mary Clarke, attended a town hall meeting that the government held at the Dighton Griffith School. She was very, very passionate about how she felt about persons who may not want to get a vaccine versus those who want to get one. And I want to welcome to the show Miss Mary Clarke. I'm not sure if it's Mrs., but Mrs. Mary Clarke, well, your video went viral, and I'm pretty much sure people all over the world heard you. And what made you go to the town hall meeting and speak out like that?
Well, first of all, good morning, Barbados. Good morning to you too. What made me go to the meetings is that I wanted to hear what the doctors had to say and what the public had to say at large, and the way forward in dealing with the virus.
So, and your comments then, and the response you got, based on the contributions that others made, clearly made you not so happy, as you expressed that unhappiness that day.
Yeah.
What was it that got to you that made you kind of wanted to speak out in that manner?
Well, first thing first, I respect other people's issues of that kind. But what made me got so peeved at the meeting is when the concerned citizens decided to take a badgering and to literally disrespect the medical fraternity of Barbados by calling them liars, practically calling them liars. One lady stood up and said, Her grandmother told her when everybody is on the same page, they are liars. And that is gross disrespect to the government of Barbados and the medical practitioners that is fighting so hard to keep us alive.
Well, I agree with you there because why would doctors want all of us dead then they don't have a job? I mean, really. So, I mean, to call doctors liars who have made an oath to save lives, I agree with you, is disrespectful. But what was it like now after you recognized you made your plea, you went home, you saw yourself all over social media, I would imagine. Your phone probably rang off the hook.
Wow.
And I might say that there were people who were for you, and there were people who did not like what you did as well. What has been that? How has been that like for you after you kind of expressed yourself?
Well, I was glad that I was able to get through to the populace that the politicians, the doctors, and everybody else at large could not get through to. Let me say the positives coming out of what I said is that the vaccination centers the next day was overwhelmed with people going to get their vaccines. Then you have the other side where people, they start mad and they're still fear because out of all of their givings and, oh, she shouldn't do that and she shouldn't say this and she can't make nobody do this. Under all of that is still the fear of catching COVID. Is still a fear. My main thing that I want to send out to the people today and to say to you, yes, we all have fears. I had my fears. But at that meeting, I gave only one instance that propelled me. May I say that I had a further scare on the 6th of July this year, when I celebrated Mass on the 4th of July, and on the 6th of July, my organist, of which I am 3 feet apart from, could say to me in the chat, I am COVID positive. I am going to her some point. The next day, his daughter joined him. Now, what scared me most is that I dragged my son out of the house to come and play for that service, and he was unvaccinated. And hearing that, I was at school when I saw that. I didn't know what to say to that child, where to go. When I said what I said to him, it was like he went haywire. I had to calm him down and say, okay, let us wait. The Saturday of that week, Dr. Mohammed called and said to me, you have to be vaccinated, tested. So I went, pick him up. We all went to the gym. The whole church, actually. The whole church, no one was left out, had to be tested. And that is how close and sensitive it is for me to know that I was right there. I could have caught COVID from my organist. But thank God, we were all wearing masks. We all sanitize and wash our hands regularly. And thank God, we were not infected. This is as close as it can get.
And this is before you were vaccinated, or this is after?
This is after I was vaccinated, after I had been vaccinated. But what I am saying, my point is, look, my son was unvaccinated at the time. And what that could have done, I went back home to my grandchildren and my daughter. Look at the devastation that could have caused if we had contracted COVID and didn't know. Look at the devastation that could have caused to my household. And I'm speaking about children that are from ages 2 to 8. Look at the devastation. Now, I am passionate about this because losing one child to COVID in Barbados is one too much. And that's that 9-year-old child. From the time I heard of that death, my heart really went out to her and her family. It's not easy to lose a loved one. It's not easy. Even though within our hospitals, when our loved ones get sick, we can't go and see them as we would like. We can't do anything we are on the outside. We can only take the clothes and hand them, and we have to go. We can't conversate with them. We can't help, bring them through whatever they're going through. And place yourself in these positions, put yourself in these shoes, and understand that is why I said that we are a selfish people. And I would like people to understand that I didn't mean it in any derogatory way, so, because that's how some people is taking it. I said that to say, Barbadians, wake up, be responsible. And I will keep on reiterating, saying, be responsible citizens. Love yourself, love others, love country. Yes, you are fearful. And to allay your fears, when you go to the vaccination centers and you are fearful or you have underlying problems, when you go to the intake person, speak to that person. There are always doctors and on hand which will take you and guide you through and monitor you appropriately.
When I heard you, and you said, and you use one of the analogies I use in life, where it happens at work, it happens in so many places where there's some really good people who try their best. Let's use a job. You're doing the best you can for a job, and somebody who's really terrible and not so kind gets the promotion. I used to say, boy, this is like the free Barabbas and crucified Jesus. And be honest with you, and I felt what you felt, and I can certainly relate to that. But one of the other things, and I'm not a Christian, but I believe in God. When I say that, I don't even know if I could call myself a Christian. I don't even think I would give myself that title, because I would leave that for my Maker to do. But there is a saying in the Bible, and someone can tell me where it came from, but I know that there's no greater gift than a man who lays down his life for his friend. And that may not mean in a literal sense, but it means that we're willing to make sacrifices for the people around us. Because I don't believe that we are here for ourselves. We are here for each other. And I connected with you when you said that. I felt your passion. I agree with you. I know that we are scared, but we got to make the best decisions, yes, for ourselves. And I believe we have more information now than we had before that can make us a little bit more comfortable. I have not grown an extra head. I might have on a little extra hair, but that wasn't from the vaccine. That was me buying it from a store. I'm putting it on my head. So the point is that I'm hoping that people get a little bit more relaxed. But on a lighter note, before I lay a gallow, Mary, there is going to be a saying from now on that Barbadians and the wider public. So when somebody look at you and tell you, sit down, and what was it again? Sit down, Winston. That was what it was.
Sit down, Winston. Yes.
Right. So I saw kind of little jokes and ads and whatever. So why was he leaving, or was he about to tell you something?
Okay. The night in question, he brought his whole group to the meeting. So there were fielding questions, and it is out of the same group that they actually called the doctors lawyers and expressed their disinterest in the government and what's not. And when I sit down and I look back at what the government, especially our Minister of Health, Lieutenant Colonel Bostic, and the government team has been doing for our country, and the medical team. When I got up to speak, I was the last speaker. He got up to go to the mic. And in one breath, I said, sit down, Winston. Sit down. Because you had enough time to bash. Let somebody give them the praises and plead with the people to go out there and get vaccine. If you don't want to be vaccinated, your choice. It is pro-choice. It is your choice. But I will say to Barbadians further, it's okay to be led to say you don't want something, but it is you, the person, that have to choose for yourself. At night, you're the only person lying down with your thoughts. You are. think for yourself. Say to yourself, what is woman really trying to tell us? Are we right in saying what we're saying, or should we do the right thing? Suppose I had to catch COVID tonight, what would happen to me?
So basically for you, Mary, in closing, and I want to thank you, is that what really peeved you even more was the comments that were being made, because you respected all persons, the positions and how they felt and the fears they felt, but you felt passionate about the comments about lies and pulling down the government is what kind of prompted you to do what you do. Well, we are out of time, and I must say you will be forever remembered, not just for your comment of sit down Winston, but also for the motivation and the passion that you would have given to many who actually decided, you know what, I can go and get a vaccine. So pat yourself on the back, my girl, because you've done well. And I want to thank you so much. And you keep being you, and you keep standing up for what you believe in is right. And that's the only way to do it, my friend. That's the only way to do it. All right, I want to thank you so much for coming on the show. All right?
Thank you, and I'm grateful.
You're welcome. When we come back, we will have Sandie Field-Kellman, educator, to discuss the new term and our children in a COVID environment. We'll be back. Welcome back to Face It and Fix It. Our last guest is a friend of mine, Sandie, Mrs. Sandie Field-Kellman, OBE educator. Sandie and I sit on the same board at St. George Secondary School, so she is no stranger. Welcome, Sandie, to the show, and I know she does not mind me calling her Sandie.
No, that's my name, actually. Thank you, Joyanne, for having me. It's such a pleasure to speak on my passion topic, education.
As always. Sandie, your observations now that we've come to the end of the school year, we're in summer vacation. What are your observations about the entire school year in review?
Okay, Joanne, that's a mouthful and great questions.
Yes, yeah.
As an educator myself, over the last year, and I would say a year and a half really, since last March, when COVID first came, as an educator and working with children, especially children who have challenges, and those children, to be honest, children like your daughter and so on, they are my pets, they're my children, because why? A lot of them are children who have possess a lot of qualities that the average high flyer child does not possess. And I think you can testify to that. They're so loving, warm, engaging, etc. And having been dealing with these children since last March, mainly through COVID, because I do that previously, I have found that a lot of children, Joyanne, have lost their way. Some would have lost their way previous to, but during COVID, a lot of children lost their way. I say lost their way, let me break that down. In other words, we had the online situation, but remember, Joanne, that if a child has challenges, COVID or no COVID, and then you are presented with online, virtual type environments, whether it is that you know how to do it, whether you don't know how to do it, that also becomes another challenge. In other words, that's a challenge along with the challenges you have. So I have found that up to now, up to yesterday, that a lot of persons and a lot more parents are calling, not necessarily only myself, other persons, other teachers, to get help with the challenges that the children have been facing or facing since COVID. So really it has put a dent, one, in the educational system, because children cannot be the normal routine going to school every day with the 30 children that surrounds them every day. They have to now get accustomed to the virtual learning. And a lot of children, as I said, who have this, that also becomes another challenge. So really, to sum it up in a nutshell, really, I really do think we are now a year and a half behind. And this is a fact, Joyanne. I have done my research. I work with people, children one-on-one, and a lot of stories have come to the fore, which I'm going to address in September, because there are lots of stories. And I really do think that in September, it's going to be a new school term. We cannot say right now what will happen, because remember, everything is a wait and see situation. So we have to abide by what's right now and hope that God does our path and Barbados to a point where the children can go back to school and be together. And when I say together, social distancing, yes, but together, not the 2 days and the 3 days and so on, going back to school Monday to Friday. But of course, all of that is a wait and see. In the interim, I usually advise our parents, grandparents, the persons who look after the guardians, the children, to really zoom in, help the children that they are surrounded by, whether it's their child, a niece, a nephew, whoever, and really keep on that child with programs. And if, as I said, if it's not programs that you can handle, there are persons like myself and others who can come and who can zoom in, do virtual programs with these children. Because at the end of the day, we want our children really stepping up to the plate, because they would have lost a year and a half, because it's a year and a half now that we have been in this situation. And I am really anxious to see the common entrance exam results, because I am not feeling that we are going to see a lot of the results that we have been accustomed seeing coming to the fore because of COVID, and because children had this lost way and lapsed attitude. A lot of children kind of like mentally, it affected a lot of children. I have 2 children that it affected mentally. So they were not able to be abreast and keep up with the schoolwork. So what I have found has benefited a lot of children and parents is one-on-one teaching, Joyanne. In other words, one-on-one teaching has come to the fore more so than 2018 and years going back. Mm-hmm. So between last March and now, a lot of persons are asking for one-on-one, mainly, as I said, children who possess challenges. So that's where we are with the educational, in my opinion, the educational situation right now. And of course, we are hoping that September we would have, well, some kind of normalcy, because it is affecting the children not only mentally, physically, in that they cannot, do the things, because children suffer with growing spurts. They cannot do the things that they are doing in a normal. So I really am hoping for the best in September. However, academic and maybe the skills and the creativity that we have, and teachers really should be on board with doing these things. We have to engage through this summer holidays. Unfortunately, there are no camps and so on. Engage their children or child in activities that can help to keep them steadfast in time for September.
What are your thoughts on the vaccine and the fact that we now have a vaccine that our children can be inoculated from the ages 12 and up? What do you think?
I am one that yes, because I was listening to Mary just now. I'm one that think that the children who are eligible to take the vaccination should have it. Because, Joyanne, we all have to live and walk by faith and not by sight. So whatever people's fears are, we have to continue living in this world till whenever our time, our number is called. So I really do think if we have to have our children back in a school setting, I think the children who are eligible for the vaccination the parents should really encourage and let them go ahead. Because at the end of the day, they have to mix and socialize with the others at the school, all right? And if those children are not vaccinated, well, then we are up against another problem, because some will be vaccinated and some will not. I encourage parents, I always encourage my parents to themselves to have the vaccination, and thank God all my parents have the vaccination, one, and two, encourage now that they're going to be, vaccinating children, to allow their girl or boy to have the vaccination. Because in life, we cannot live in fear. We have to walk by faith and be positive. And all these things that people are talking about, this and that, and illnesses and death, I don't share that. To be honest, I don't share that. Because I believe in my God, and I know that He wants the best for us. So I think my stance on that is in children who are eligible to take the vaccination for the new school term.
Okay, well, I want to get away from the COVID talk for a second and talk about education and applied sense. Because sometimes we find that people may have some degrees, and that's great. We want to support people who get an education. But I find that sometimes people feel that having a degree means that you're educated, but then you don't really have any basic applied sense to situations and real life situations. So one of the things I wanted to share with you is, when we teach children, when a train leaves the station at 7 and it makes 2 stops, one 15 minutes, one 16 minutes, what time did the train arrive type of thing, that's fine. But if there was a problem along the way that you need to encounter, and you have to encounter, we don't teach our children life skills to the extent and the problem solving to the extent that we should. Because if we did, right now in the pandemic, some of the comments that we are hearing, we might not hear it, because some people are displaying a level of ignorance maybe to a lot of things. I get it that you want to ask questions, and you should. Knowledge is power. But is the interpretation and the comprehension of what is actually happening, and for them to respond, it kind of bothering me somewhat that maybe we are failing in the system as it relates to what Bajans would say, or everybody would say, common sense. I call it applied sense, because if it was common, I believe we would all have it. What are your thoughts on problem solving and life skills that we can concentrate a little bit more on, so our children have the ability to reason and have better judgment than what we see now today?
I'm glad you question, Joyanne. That area actually is one of my favorite areas in education, in that I have been calling for reform, not now, for years. And I am one that was privileged, and I like to use myself as an example and not things from a book. I was privileged to have been exposed to a well-rounded life at school and abroad. And I'm saying that to say if a child is not academic, and I just did an interview with National Geographic, which is going to be published here next week, actually, on reform education. And my stance is, I don't believe that you have to have any certificate to get through in life. The best, and they look around the world, the people who are calling the shots, running the world, are sometimes people who have never been to university, who don't even possess a piece of paper. But what we need to do to get there, to find a niche in the world, is from the cradle, from infancy, you are to equip children, both boys and girls, with the skills that will carry them through till 18, 19, 20, whatever, because some of those children will not be academic. But if you teach them things like to be articulate, enunciation skills, oral skills, verbal skills, social skills, the ability to communicate, carry on a conversation, put those skills together, Joyanne, it adds up as a degree, if you understand what I'm saying.
Yes,
So
of
if
course.
you possess all those qualifications, there is a niche market in the world for that boy or that girl or an adult, all right? And this is where reform comes in. Be no longer looking at the Harrison colleges and the Queen's colleges and all those things and think that those children are really the people who are going to run the world. Actually, when I look around, and I am a creative myself, okay, I don't have a PhD, I don't want a PhD. I have common sense and all those skills I just called, and I have found that those skills have taken me and brought me to where I am now. So I'm saying a piece of paper and a degree, as what you asked, is not necessarily the end all of your life. So children should be taught things in sign language, okay? And this is from the cradle. And when I say the cradle, not at primary and secondary. The child that goes to the kindergarten, what they call it, daycare, whatever, preschool, social skills, articulation, how to verbalize, Joyanne. Our children are lacking in oral skills. You ask children things here and they cannot give you 5-word constructive sentence, all right? How to be, how to relate, how to stand, how to sit, how to smile, how to communicate, all those things. How to write. Handwriting has gone through the chute. Handwriting when I was growing up was important, all right? Now the children are writing like what my mother used to call skinners and spotters on the paper, all right? How to relate to persons when you come, good morning, Joyanne, and how to ringtones in, good morning, rather than good morning. Teaching children how to put that swing and that song in what they say. These are skills to be taught in the preschool, all right? So that when that child reaches to primary and to secondary, along with the other subjects, and I strongly believe it should be mandatory, Joyanne, okay, that every child in this country join a civic organization.
I think that you are correct. I actually felt that after you finish school, before you can even touch a job, you should be either, well, for maybe the boys, actually, no, I don't want to just say boys, because boys and girls, they're all in the service of BDS. But exactly. you have to, and more charitable things. I think having them go out there and visit old people's homes and the challenge school and things like that will give them credits then on to the other things with their exams. You should not leave school without those things. But Sandie, we got to take a break and we're coming right back with more from you. We'll be back after the break.
Thank you.
Welcome back. We are talking to Mrs. Sandie Field-Kellman, OBE educator. Sandie, tell me, when you have children passing through you and then you realize that they're in the 20s, they're not doing well, they're probably doing drugs, entering a life of crime, how does that make you feel as an educator, knowing that that little one was so cute, you know, and did so well?
Yes, and adorable.
All of a sudden, things changed. How does that make you feel?
Joanne, to be honest, thank God, in my teaching career of 28 years, I have not had that experience. And I think it is because when you give the children, as I said, fundamental skills from young, and when I say fundamental, I also want to put in the faction of spiritual grounding. That is very important. It's not all about going to church and all that, but spiritual, the tenets of life, the 10 tenets of life. All right? So I have not had that experience, thank God. But I actually, right now, I work and teach at Verdun with boys who bend that road and who are now rehabbing. And Joanne, it really makes me hurt in my heart to hear some of these stories. These true, real stories of boys, okay, who went the wrong road. And you know what they all tell me? They want to put their life straight and back on the right path, okay? And the reasons why they ended up on drugs. The reason, some of them were taking drugs from 6 years old. So it comes back again to the home. The home is a fundamental place for honing children's skills, okay? And there are certain things you need to teach children so that by a certain age, it's so inculcated and ingrained in them. I'm not telling you that some do not stray, don't get me wrong, but sometimes that's 1 out of 10. But once those children are ingrained with certain life skills, I like to use the word life skills, all right? You tend to find if they continue to have guardians or persons around them who continue to be around them and give them positivity, that child really does not turn out, to be honest, when they're in their 20s.
Hardly,
issues.
hardly ever. But
Hardly.
I want to mention something else before, because I know we're running out of time. Sandie, you deal with a lot of young ladies and your girl guides. I see you post a lot of pictures, and you're so always proud of your girls because you call all of them your children.
That's right.
I strongly believe that even though we need to spend time on both girls and boys, that I find that we have a tendency to focus on the boys going astray, but not recognizing the girls got a major influence on the boys. So should we kind of be looking at the girls so that, because they influence them. Boys want to impress the girls, and the girls can manipulate the young boys. But so we are worried about the boys. Shouldn't we kind of be worried about the girls and trying to say, listen, this is the kind of power you have, but don't abuse it. In other words, tell her, listen, if that young man you're going out with is going astray, pull him back. Because I think that most young boys may listen to these persons, but I got to give you the final word in like 30 seconds, Sandie, because we have to go. So sorry.
Yes, yes, Joanne, too short a program. Yes, I agree with you, but for me, I think that if each one of us in this country takes one girl, takes one boy, and try to work like a buddy system, we will have less issues. Right? But I'm continuing to hear all the issues and the issues. But what are we as individuals doing? I am doing my part. I go over the board with mine. All right? So I'm saying it can be done. We don't want to save the world, but we want to save most of them. And these things, as I said, knitting, stamp collecting, for those Joanne or skills that I did when I was a girl. So then playing the guitar, swimming, all the types of Girl Guides, Girl Scouts, 4-H clubs, those things, when children are employed, their minds are employed in something like that, in a skill, you will tend to find that those children will keep on the straight and the narrow path. Because why? Somebody is there and they themselves, they have something to equip them. stamp collecting. Remember about stamp collecting?
I remember
Nobody
stamp collecting.
Exactly. So I'm saying all of these are things that I introduced them.
Maybe because there's more less snail mail. But Sandie, I want to thank you so much. I really want to thank you so much for coming. And what we will do, Sandie, before the beginning of the term is to bring you back and give you more time, because we really want to hear a little bit more about education.
Yes, I haven't even scratched the surface.
I know, and I know when you get started, you know, you scratch deep. So let's
come back.
For sure, Sandie. It's nice seeing you. You look lovely. Thank you so much. Thank you.
I'm off to teach. Have a wonderful day.
You too as well. We'll be back after the break. Welcome back to Face It and Fix It. We're coming now to the end of our show. I just want to let MTW know that there is a tree falling almost into the road in Darrell's Road in Christchurch, Buttonbound, Christchurch, St. Michael. It's by a sign called Panographics, by Risha's Hair Salon, Tikara's Nail Salon. But the tree is literally, it's tall, but it's really hanging over the road, and at some point, if it rains a little bit more, it's going to fall on some cars. So MTW, I'm appealing to you to please kindly go into Darrell's Road, look for that area, and see whether or not you can get that repaired. I want to thank all of our guests, Dr. Corey Forde, an amazing doctor, Dr. Charles, also an amazing doctor, who they're always willing to come on to talk to us and to guide us really during this pandemic. I can tell you that right now, I think, and I said it earlier, that COVID has literally sucked all of the oxygen out of the atmosphere. It has taken over everything, and I'm hoping for our country to go back to a state of normalcy, should I say the whole globe. And the only way that we can do that is to see whether or not we can get the numbers down, because they have not found a cure, but they've found a vaccine, one that works to a certain extent. And when I say a certain extent, nothing in life is 100%. So we want to thank all of you, all of our listeners, our viewers in Barbados and around the world. We hope that we brought you something that would educate you somehow and make you feel better. And we're hoping that we can't mandate the vaccines, and no one can, but hopefully with the information that it will give you cause to pause and to think a little bit more as to if you want to get that vaccine, if you want to save yourself and others around you and bring this country back to a state of normalcy. People are tired. People want to be free of this, and I'm hopeful that some of you who are on the fence, you think about it. I've taken it, if that's worth anything, and maybe not, but I hope that you consider that too as well. I want to thank you, and until Monday, God bless, take care. I'm Joanne Haigh, and this has been Face It and Fix It.